Your orthodontic appliance. So many people have orthodontic appliances in their mouths and yet have very little understanding of what the components are, what they do, and what they're even called. This is an illustration showing fixed appliances in the upper and lower dental arches. The back brackets are the individual metal or sometimes porcelain or even plastic attachments that are bonded to the tooth using an acid etch technique that control tooth movement. So these are the actual parts that are used to move the teeth themselves. So that's attachment onto the tooth. You then have the wires running through these brackets. Classically, here's the arch wire. Classically, the arch wire is straight in the modern straight wire appliance, so that each of the individual brackets have been tailored for the size of the average tooth in that position. The slot in this arch wire either comes in 0.022 of an inch or 0.018 of an inch, of course, because fixed appliances tend to be developed in the US, whereas removable appliances were being developed in Europe. The measurements for fixed appliances tend to be in inches, whereas the measurements for removable appliances tend to be in millimetres. And although wires tend to be straight, but previous to that, wires tended to be bended individually. So each specific person, there was bends made for each individual tooth for each individual person. And at that point, when a lot of wire bending were going on, it was more common to place little loops and bends within the wires. They're less common today, but they can be very useful for changing the mechanics of the wire, putting a little bit of springiness in that particular section, putting a height differential in that position, or even placing a point where elastics or other treatment appliance components can be fitted to. Now, on back teeth, it was traditional to place bands, but it was traditional to place bands on all of the teeth before the modern acid etch techniques came out. It's becoming more and more common now to place brackets on all of the teeth, including the back teeth, as the strength of these bonds has increased. However, many people still place bands on the back teeth, and the bands are just a stronger way to holding on to the tooth, particularly those big back teeth, tooth number 6, which are some of the biggest teeth in the mouth, or the first permanent molar. Now, whether or not a band or a bracket is placed on tooth number 7 largely will depend on the individual situation and the orthodontist concerned. Some orthodontists do, some orthodontists don't. Now, many of the brackets themselves, or placed onto the wires, you can have little hooks. Classically, the hooks are placed on tooth number 3 and tooth number 6. From these hooks, elastics can be run. Then also on some of the bands, and it wouldn't usually be a band where this is placed, you can have headgear tubes. It would usually be on tooth number 6 where a headgear tube would be placed. And this can use extra oral anchorage. So if you feel, or the orthodontist feels rather, that a little bit of extra force is required, more force than could be anchored from within the mouth, he can anchor that outside the mouth. So he can place a head brace, and that can be used to introduce a force system within the mouth that's independent of the oral cavity, which is quite useful at times. Now, around the bracket holding the wire and the bracket together, you can either place ligature wires or you can place little tiny rubber bands. Now, these are the little rubber bands that are frequently coloured. They're called modules. and they could come in lots of different colours, and frequently kids get very excited about having different coloured elastics holding their elastics on their brackets, because this is clearly what you notice when you come round. And that is more or less all of the components of fixed appliances. Of course, there's many other less commonly used components that aren't covered here.